Hello guys, welcome back to my channel Religiously Fit. So I hope everyone is doing fine and keeping well. So guys, today we'll be doing chapter number 15 of ACE Personal Trainer Manual 5th edition, which is Common Musculoskeletal Injuries and Implication for Exercise. This is chapter number 15. This is going to be considerably a long chapter because this has a lot of content to cover, and I have my computer notes as well as my handwritten notes. So probably I may make a video in two parts, or let's see, or maybe one part if I can complete this within a half an hour. Okay, so we'll be starting, just give me a moment. Okay, perfect. Okay, so we'll start the chapter. With first topic, which is strain. Okay, muscular strain. So tissue and common injuries which are caused in our muscles. So what is a muscular strain? It is a microscopic tear of the muscle fiber. Okay, it is a microscopic tear of the muscle fiber. Okay. So there are different like grading, grade 1, grade 2, grade 3. That depends on how much tear that muscle have got. So grade 1 strain is mild strain, tender and painful with possible localized spasm, pain. Grade 2 strain is moderate strain with large number of fibers are injured with more severe pain and tenderness, which can be seen as mild swelling, noticeable loss of function and possible bruising. Grade 3 is complete tear, which is complete loss of muscle function, severe pain, swelling, tenderness, discoloration, and palpable defect. Okay, so these are the three categories in which the intensity of strain has been categorized. Okay, then comes the ligament sprain. Okay, you know what is tendon and what is ligament. So tendon is something which connects bone to the muscle, like this, the bone. Okay, there's a bone here, it connects the muscle, this is the bicep muscle, to the there's a connection between bone and muscle, that is through a tendon. Okay, you can push yourself here, like push your bicep muscle to where it ends, and you can feel that this is the tendon muscle. Okay, and what is ligament? Ligament is something which connects bone to bone. Okay, which connects your femur to your tibia. Okay, through your kneecap, that is a ligament. Okay, so what are ligament sprains? Ligament sprains are simply something which happens in ankle, knee, shoulder. Okay, this, knee and shoulder. Okay, where the bone to bone is connected through a ligament. Okay, so there are also a grading system in ligament tear. Grade 1 is minimal tenderness, swelling and impairment, micro tearing of collagen fiber, the fiber from which muscles are made up of. So how do you care it? Through RICE technique. What is a RICE technique? That is rest, ice, compression and elevation. You take rest, you put icing on that ligament, you compress, like you put a bandage on that, or maybe in worst case scenario plaster on that, and elevation, you put that like your shoulder, your this joint or your knee joint a little elevated as compared to your body. Okay, so what is grade 2? Grade 2 is moderate tenderness, swelling, impairment, decreased range of motion, possible instability, complete tear of some collagen fibers. Okay, and what is the care for this? RICE, that is again rest, ice, compression and elevation plus physical evaluation. So guys, I have these computer notes. If in case you need these, you can just let me know in a comment on my YouTube video, and I'll be happy to share them with you. Okay, going to the grade 3, which is significant swelling and tenderness in your shoulder, in your knee, in your ankle, knee, shoulder. Okay, significant swelling and tenderness, severe impairment, instability, complete tear, rupture of ligaments. So the most important thing when it comes to tearing, sprain or strain, these keywords like complete tear or rupture. Okay, and complete in grade 1 it was, I'll tell you, in grade 1 it was micro tearing of collagen fiber. In grade 2 it was complete tear of some collagen fiber, and in grade 3 it is complete tear and rupture of ligament. Okay, so please concentrate on these keywords. You might get a question in exam, and you can only identify if is it grade 1, 2, or 3 based on these keywords. Okay. Okay, so moving to the next one. Okay, so grade 3, what is the care for that? Immobilization with an air splint. Okay, and rise and physical evaluation. Okay, now going to the next topic, which is called anterior. Let me read from my handwritten notes. Anterior cruciate ligament. Okay, so what is this connection? What is this condition called? Okay, so where your tibia and femur, they are connected. Okay, what happens is they are connected like this, but and this is tibia and this is femur. Okay, like this. Okay, the tibia goes a little ahead of femur. Okay, okay, so this condition called ACL, that is anterior cruciate ligament. Primary role to prevent anterior glide of tibia away from the femur. Okay, this condition is seen mostly in females. This is like 2 to 10 times greater risk. Females are at greater risk as compared to men. And what causes this ACL? Like these joint, this is my, okay, I can show you like this. This is femur, this is tibia. So what happens is this tibia goes a little ahead of this femur in this kneecap. Okay, that causes anterior cruciate ligament. The causes are deceleration, like sudden deceleration, sudden stopping, twisting, pivoting of side stepping. Okay, like when you do a lateral stepping, a lateral lunge, something like that, like lateral movement, sudden lateral movement. It is often traumatic and requires immediate medical care. Okay. Hello guys, welcome back to my channel again. So now we'll be continuing with our chapter number 15. Okay, by mistake actually that video got paused or stopped, so I'm making this video again. So we had to start with medial collateral ligament, which is also called MCL. So this is basically like earlier we talked about anterior cruciate ligament, in which the tibia slides over to the femur. Okay. And in medial collateral ligament is what happens is it prevents the knee to cave in. Okay, knee valgus, which is also called. So primary role is to prevent knee valgus, medial bending of the knee. Like for example, when you do a squat, okay, in some people you might have observed that their knee tend to cave in. Okay, so that condition is called medial collateral ligament. When some kind of injury, like I'll read it for you. Less common and often associated with complex knee injuries where more than one tissue rupture occurs. Okay, cause could be impact to outer knee with no twisting involved. Impact to the outer knee with no twisting involved. So these could be the cause of MCL, medial collateral ligament. Guys, see, in chapter number 15 there are so many conditions there with such like kind of complicated medical names. So you have to remember these first of all, because definitely you are going to see many of your clients who are suffering from either or any or maybe a couple of these conditions. So like as of now you are reading them for the first time, so it might be overwhelming for you, but trust me, you have to go through them, you have to understand, and it would be better if you go to YouTube and type these names and then see what exactly happens in these conditions, like anterior cruciate ligament, MCL, overuse conditions like tendinitis, bursitis, chondromalacia. These are all overuse conditions. When you overuse your muscle and the joints, then these kinds of condition happens. Like overuse condition are tendinitis, bursitis, fasciitis. That means too much of use of that muscle, of that joint, okay, and too soon. So inflammation occurs as a response to this, to repetitive stress. Okay, like for example, people who are working in post offices, they tend to use their thumb a lot. Okay, so they tend to develop a disorder, or you can say a condition in this joint or maybe this joint. Okay, so like people who play tennis, they tend to have overused their elbow. Okay, and in different sports people tend to use repetitively a specific joint, so sometimes they get these conditions like overuse condition called tendinitis or bursitis. So the next is chondromalacia, which is also called which is the problem of kneecap. Okay, which is also called patellofemoral pain syndrome. So softening or wearing away of cartilage behind the patella. This is patella, okay, the kneecap. So there's a fluid, there's a fluid behind this kneecap. So softening or wearing away of that cartilage. What could be the causes of this? Posterior surface of patella, that is the posterior, the back part of patella, not properly tracking the femoral groove. See, what is this? This is femur, this is tibia, this is patella. Okay, so the femur is going inside the kneecap. It is attaching to the inside part of the kneecap. So what is happening? What is causing this patellofemoral pain syndrome or chondromalacia is posterior surface of the patella, that is the back part, the posterior anterior. We studied it, remember? Anterior is the front, posterior is the back part. So the back part of the patella, that is kneecap, not properly tracking the femoral groove. Okay, there will be a groove, there will be this kind of thing where the femur is going to stick in. Okay, so the back part is not able to hold that properly. Poor running styles, this happens because of poor running styles, sudden changes in running surfaces, over pronation of feet. What is pronation? When your feet are like this. Supination is when the feet are inwardly they are tend to be inward, like my own legs are supinated a little bit inward. Pronated is when their feet are tend to protrude outwards. So knee appears to be swollen and warm, so swelling can be seen, and pain usually occurs behind the patella and increases when walking up or downstairs. Okay, when you are walking up or you are going downstairs, then you feel pain behind the kneecap, that is patella. Okay. Bursitis is the second overuse condition. Inflammation of bursa due to acute trauma, repetitive stress, muscular imbalance, muscular tightness on the top of bursa commonly affects the shoulder, hip and knee. Okay, so bursitis can be mostly seen in shoulder joint, hip and knee joint. Next one is fasciitis, which is also called plantar fasciitis. Plantar fasciitis, which is inflammation of fascia, that is the connective tissue, commonly occurs at the bottom and back part of the foot and has been linked to various intrinsic and extrinsic factors. This is fasciitis. So I am wearing a shoe. I need to remove my shoe. So this happens basically here in the back and the bottom part of the foot. Fasciitis, or called plantar fasciitis. And what is pronation and what is that? I forgot that. Arching of foot. Okay, anyways, that is not related to this. Okay, coming to the next one, which is tendinitis. Inflammation of tendons. Tendons, you know, as I explained in this chapter in the last video. So occurs in elbow, shoulder, ankle, knee. Okay, elbow, shoulder, elbow, ankle and knee. Okay. Tendinitis, inflammation of tendons. Tendons is where the bone is attaching to the muscle. Next comes is greater trochanteric bursitis, which is also called GTB. Painful inflammation in greater trochanteric bursa, commonly in female runners, skiers and ballet dancers. Prolonged running or prolonged cycling or prolonged kickboxing can cause this GTB. Tingling, prickling, numbness radiating from the greater trochanter to posterior lateral hip or lateral knee. Okay, so it starts from trochanter area till the posterior lateral hip. Okay, the posterior lateral hip or the lateral knee. Lateral always means side. Okay, so side, the back side part of the hip or the side part of the knee. Okay, what is the treatment for this? Physical therapy, ice, heat, avoiding aggressive activities, and especially avoid side lying position that compresses the lateral hip. So avoid side lying positions, like when you are sleeping. Avoid side lying position for the clients who are having this GTB condition, which starts from the trochanter to the posterior lateral part of the hip or the knee. Okay, and exercise would be stretching the IT band, that is iliotibial band, that is on the side part of your leg. Okay, iliotibial band, and deep hip rotators. Okay, so these you have to strengthen your glutes, deep hip rotators and IT band, hamstring and glute. These would be the target muscle for these for fixing GTB. Okay, coming to the next one, which is IT band, iliotibial band. This is also an overuse injury. Pain in the lateral side or the outside of the knee, lateral side or the outside of the knee. Okay, and aggravating factors is downhill running or cycling. The factors which increase this condition could be downhill running or cycling. It goes away with resting. Okay, increase if not treated, obviously, and try to regain flexibility, strength at the hip and the lateral thigh. Okay, so you need to what is hip is this part of the body is hip. Okay, this part. So you have to strengthen the hip and the lateral thighs is this. Okay, which is also IT band. Progress from 45-degree knee flexion to 90-degree knee flexion. Okay, doing the exercises from 45-degree knee flexion to 90-degree knee flexion. Okay, next comes patellofemoral pain syndrome, which is also called runner's knee, which is what? Anterior knee pain. That is the frontal part of the knee. Okay, causes is flat foot or high arching of the foot. If your foot is flat, there's a high arch in the foot. Okay, these are the causing patellofemoral syndrome. Okay, tight hamstring, calves and weak quads and hip muscle. So these are the muscle which you need to strengthen to fix this patellofemoral pain syndrome. Tight hamstring, calves could be cause of this, weak quads and hip muscle. So we have to concentrate on these muscles for fixing the syndrome. Pain behind the patella, that is under the patella, that is kneecap. So when you are going up or you are coming down the stairs, this could happen. Avoid doing deep squats, downhill running, prolonged sitting, and avoid open chain exercises like leg extension. Open chain, there are two types of exercises, open chain and closed chain. Open chain is where your extremities are open, they are not fixed, and closed chain is when your extremities are attached to the floor, like touching the floor, or maybe you are in a closed circuit kind of thing, like you do a push-up, that's a closed chain. And open chain means like your extremities are open, like you are doing leg extension. Okay, so avoid doing these exercises. Do lunges and squats, physical therapy and knee braces. Sometimes you need to wear knee braces if the condition is very critical. Stretch your hamstring and calves muscles, strengthen throughout hip, knee and ankle. 45-degree of CKC exercises, close kinetic chain exercises. Okay, now how much is left? I think we have a lot of material left in this chapter. Okay, the next one is infrapatellar tendinitis, okay, which is also called jumper's knee. Jumper's knee is infrapatellar tendinitis, and runner's knee is patellofemoral pain syndrome. Okay, so you have to remember what is jumper, what is runner. As the name suggests, jumper's knee, this thing is seen most common in people who does this kind of job. Pain in the distal kneecap, okay, causes could be poor running style, change in training surface. Avoid plyometric exercises, deep squats or prolonged sitting. Okay, again, this is going to be very simple. When you are going to read these things again and again, and you are going to watch some videos explaining these conditions, then definitely you are going to understand naturally that what are the things which are causing these problems, and what are the exercises which you must definitely avoid, asking your clients to do those, and what are the muscles which you need to target to strengthen them. So again, you have to avoid plyometric exercises, which are sudden movements, deep squats, because it involves knee a lot, it puts a lot of stress on the knee. Okay, prolonged sitting, because again that is also going to damage your knee. Prolonged sitting, so you need to stretch your ID band, the lateral part of your leg, hamstring, calves, and strengthen throughout hip, knee and ankle. This is very important, strengthen throughout hip, knee and ankle. Okay, so there is a difference between patellofemoral pain syndrome and infrapatellar tendinitis. The infrapatellar happens on the distal side of the kneecap, and the patellofemoral happens on the anterior side of the kneecap. Now comes shin splints. Okay, what is shin? Shin is this muscle. Okay, shin splints, which is called exertional leg pain, which could be caused by uphill or inclined running or hill sprints. Okay, remember, you have to remember all these words, what has to be done, what should be avoided, what exercises need to be strengthened on which muscle group to fix which condition? This is very important. Okay, so shin splints is anterior shin splints are common in runners and military personnel. Okay, they tend to overuse this muscle, so they get this condition, shin splints. Two types of shin splints are there. One is medial tibial stress syndrome, which is also called MTSS, are common in runners, dancers, and military personnel. Okay. So sometimes I'm not able to even read my own handwriting. Along the distal 2/3 of the posterior medial MTSS, or pain along the distal anterior. Okay, so one is medial tibial stress syndrome and the other is anterior shin splint. So basically anterior is the front part of the shin and medial is the side middle line of the medial part of the shin. So the shin splints are of two types, MTSS and ASS, anterior shin splints. Rest and ultrasound could be the things which can fix this condition. Cross training and stretching soleus and anterior compartment of lower leg. Cross training and stretching the soleus. What is soleus? This is the soleus muscle. Okay, I'll show it like this. This is the soleus muscle. Okay, and this is the gastrocnemius muscle. Okay, soleus is the entire volume of your calf muscle and gastro is for the density of your calf muscle. So cross training and stretching the soleus and anterior compartment of lower leg can fix shin splints. Okay, next comes Archerless tendinitis, which is most common in gymnasts, dancers and runners. Sharp pain or burning pain in the morning. This is a symptom and you have to remember this word. Pain could be 2 to 6 centimeter above the tendon insertion into the heel. Okay, you have to watch a video for this where the tendon, okay, I'll show you again, where this thing is getting inside the heel. Okay, pain in 2 to 6 centimeter above the tendon insertion point, where the tendon is getting inserted into the heel. Above that 2 to 6 centimeter above that point, this sharp pain happens, especially in the mornings. And ice and resting are the things which can fix this. Controlled eccentric strengthening of calf complex. Okay, controlled eccentric strengthening of calf complex. Standing with heels hanging off the edge of a step. Overstretching of Achilles tendon should be avoided. Overstretching of Achilles tendon. So you should not be like overstretching your leg. Okay, overstretching should be avoided. And the movement, the eccentric movement for strengthening the calves has to be controlled, slow and controlled, nice and slow. Intrinsic factors like leg length discrepancies. Sometimes the left leg and the length of both the legs are different. Lateral ankle instability. The lateral part of the ankle, okay, is unstable, because of which this Achilles tendonitis, sharp pain in the heel can happen. And age, and again the flat foot and the high arch in the foot could be the reason behind Achilles tendonitis. Coming to the next point, which is plantar fasciitis, which is exactly in layman's language or common language, this is also called heel pain. Inflammatory condition of plantar fascia. Most common cause of heel pain, common in obese individual, and accounts for 10% of the burning pain. Okay, I think I'm getting some notification. I need to stop that. Okay. Excessive pain during first few steps in the morning. This is the thing with which you will be able to recognize, okay, this is what this condition is. Again, this is not your job, this is the job of a medical practitioner. But if you know that your client is suffering from plantar fasciitis or Achilles tendonitis or ACL, MCL, Shin Splints, Infra Patellar tendonitis, patellofemoral pain syndrome, then you have to take necessary and appropriate actions. Okay, and you have to avoid doing certain exercises, and you have to strengthen their muscles so that their pain goes away. Okay, so factors behind plantar fasciitis. I think this snowstorm. Okay, because of that snowstorm, okay, some disturbance is happening. Okay, no problem. Okay, so factors behind plantar fasciitis would be obesity, again, flat foot arching, improper footwear. Okay, stretching, where do we have to stretch? The calf muscle and plantar fascia. Rolling foot over a dumbbell. golf ball, etc., can increase range of motion in the plantar, the base part of the foot. Okay, rolling over a dumbbell or a ball, golf ball, can increase the range of motion of your plantar, so that your foot will be able to flex and extend. Strengthen the calf and anterior and posterior tibia. Okay, anterior and posterior tibia. Yeah, that is behind your knee. Anterior and posterior tibia, front part and back part of your calf muscle. Next come ankle sprains. What are ankle sprains? Lateral inversion. Ankle sprain are most common, lateral or inversion. Okay, the side part, which is typically inversion with a plantar flex foot, Okay, ankle sprains happen when you are walking on a maybe a slippery roads kind of thing. Your ankle turns around and you feel sudden burst of pain. So that is what is called ankle sprain, in which the lateral inversion of your foot happens. Okay, and medial eversion, like this can be lateral inversion or medial inversion. Ankle sprain are relatively rare, which is typically forced dorsiflexion or eversion of ankle. So medial eversion is when your foot is like turning towards your midline of the body, and lateral inversion when your foot is turning outside the body, away from the body. So these two kinds of ankle sprain can happen, and the medial eversion are less common and the lateral inversion are the most common. So ankle sprain are common in basketball, volleyball, soccer and ice skaters. Progress with straight plane motion such as forward running. Okay, you are asking your clients to run forward, not laterally, never ever laterally in this condition. So progress with straight plane motion such as forward running, then side to side motion such as side stepping. Okay, side stepping. And then multi-directional motion such as carioca. For that you need to visit a figure, that is 15.11 on page number 593. I have also written, because I don't remember carioca. I know that I will not be able to remember this, so it's very important to visit the figure. And these were the progression. Like first of all, you have to ask your client to step forward. Then if they are comfortably stepping forward in a straight plane motion, then the next progression is side to side motion, like side stepping. And the third is multi-directional motion, like, okay, you'll be able to, you just type multi-directional motion, or you just type ankle sprain exercise progression, you will be able to see on YouTube. Next come the rotator cuff injury. Strains often involve a tension, while sprains often involves a ligament. I don't know why I have written this thing here, but it seems like it's important. Strain, obviously, strain happens with tendons. You have to remember this. Strain happens with tendons, and sprain often happens with ligament. Okay. So complain of local pain at the shoulder that radiates down the arm, could be shoulder strain or sprain. Okay, place the shoulder 30° anterior to the frontal plane, which is also referred to as scapular plane. From this position, do all exercises and shoulder press. Okay, so you have to place your shoulder at 30° in anterior into the frontal plane. Okay, so like this is in line with my body, and now this is 30° ahead of it, anterior part in the anterior plane, anterior to the frontal plane. And then ask your clients to do like for example a shoulder press like this. Instead of doing it like this, ask them to do it like this. Okay, rotator cuff injury. Okay, so now comes the next thing is acute injury. Sudden trauma like falling on the shoulder or trying to lift overwhelming weight by raising the arm. Immediate pain followed by severe loss of function, common in people under 30 years of age. Okay, this is called acute injury. I'll read it again for you. Sudden trauma like falling on the shoulder or trying to lift overwhelming means a lot of weight by raising their arm. Okay, like this, raising their arm a lot. Okay, that can cause immediate pain followed by severe loss of function. Severe loss of function means next time if they are trying to lift like lightweight, the range of motion is very restricted or limited. Okay, now comes the next one, which is chronic injury. Gradual or repetitive stress. This is caused because of repetitive stress, or gradual, slowly. Okay, chronic is slowly and acute is sudden. Gradual worsening of pain or weakness. Tears are this case are a result of degenerative process. Tears means tearing. Okay, not tears. Common in people above 40 years of age. Dominant arm is most affected. Males are more susceptible to this injury, reaching overhead behind the back is painful for those people. Grabbing an object from a higher shelf or putting a shirt on is difficult. Okay, it is snowing very hard and I have to travel back to my home, which is around 40 minutes from here. Okay, anyway, so chronic injury is because of gradual and repetitive stress. I'll read it again for you because this chapter is really very, very important with respect to your actual life, your own experience and hands-on. So gradual worsening of a pain or weakness. Tears are in this case are a result of degenerative process common in the people above 40 years of age. Dominant arm is most affected. Males are more susceptible to this injury. Reaching overhead or behind the back is painful. Okay, like this behind the back. Grabbing an object from a higher shelf or putting on a shirt is going to be difficult. Solution: what is the solution? Immobilized for 6 to 8 weeks. Cleared for gym activity after 16 weeks approximately. Build on what has been done in physical therapy in a safe, progressive manner. Overhead activities and keeping the arm straight during exercise, okay, like front raise with elbow locked out, should be avoided. Exercise with elbows bent will create less torque on the healing muscle. So these are the solution which you need to take care for the people who are having chronic injury. Okay, the video is already 24 minutes and how much content is left? Okay, 2, 3 or more page. Elbow tendinitis is the next topic. Lateral epicondylitis. This is also called lateral epicondylitis, or in simple language tennis elbow, which is elbow tendinitis, is the overuse or repetitive trauma injury of the wrist extensor muscle. Okay, the muscle which, see what is this? This is flexion. This is flexion. This is extension. Okay. So this is the way the people play tennis. Like it's not like it is always happening to tennis player. The name has been kept on pasted, like the name belongs to tennis, has been taken from that game. Is the overuse or repetitive trauma injury of the wrist extensor muscle. Okay, this helps to extend the wrist. Medial epicondylitis is also called golfer's elbow. Okay, golfer's elbow is the injury of the wrist flexor muscle tendon. Okay, golf is played like this. Okay, golf and the tennis both are played like this, but there's a difference. There's a basic difference based on what muscle they are involving. So medial epicondylitis is because of wrist flexor muscle, which helps to flex the wrist. Okay. Nagging elbow pain during activities like shaking hands, turning doorknobs, cooking and carrying load. Nagging elbow pain during activities like shaking hands, turning doorknobs, okay, carrying something or cooking, carrying load or cooking. Wear wrist or elbow splints, like sometimes they give you a splint which you can wear like just like a plaster in India. They give you a splint which you wear on your elbows. Regain strength and flexibility in flexor pronator. Regain strength and flexibility in flexor, which is also called pronator, and extensor, which is also called supinator. Muscle group with low weights and low repetition. Avoid high reps like 15 to 20. Avoid locking out the elbow during front raises. Okay, like you are doing a front raise, try not to lock your elbows. Okay, try to leave them a little fluid, little flexible, not try to lock them, not try to put a lot of stress on this muscle. Okay, so you'll be able to regain strength and flexibility in flexor and extensor muscle group with low weights and low repetition. This is the most important thing, low weights and low repetitions. Okay, and avoid locking your elbows while doing front raises. Okay, next comes the carpal tunnel syndrome, which again involves a wrist. Okay, narrowing of the carpal tunnel due to inflammation, eventually compressing the medial nerve. There's a nerve going here, which is responsible for all the activities our hand does, which is a very important nerve, median nerve. So narrowing of the carpal tunnel. Okay, you again have to visit a YouTube video, maybe type it on Google and see what is carpal tunnel. Common in females, especially from 40 to 60 years of age. Cause is repetitive wrist and finger flexion. Okay. Symptoms would be night or early morning pain or burning, loss of grip, dropping of object, numbness and tingling in the palm, thumb, index, middle finger. like palm, thumb, index or middle finger, any of these. Avoid full flexion or extension. Avoid full flexion or extension. Exercise should focus on mid-range of these motion. Okay, mid-range, not full flexion or full extension, but the mid-range. Okay. And always try to remember the people who are having this CTS, carpal tunnel syndrome. Don't ask them to do a lot of exercise which put a lot of stress on their wrist. Okay, like doing push-ups and all. Okay, try to, or planks on hands. I think, okay, there are two more topics. One is lower back pain, which affects like 80% of the population, which involves sciatic nerve, which is longest and widest nerve in our human body, mechanical pain, degenerative disc disease, and sciatica. These are the things which comes under lower back pain. In medical language, they are called degenerative disc disease, DDD, and sciatica or sciatica. How do you spell it? It depends on you. So risk factor could be smoking, obesity, pregnancy, stress, depression, prolonged static postures. Mechanical pain is because of poor muscular strength and flexibility, leading to pain and decrease in activity. And what is DDD? Invertebral disc degenerate, common in the age of 30 to 50. DDD, degenerative disc disease, in the people from 30 to 50 years of age. Bulging disc and disc herniation occurs between 4th and 5th lumbar vertebra, or between 5th or 1st sacroiliac joint. You have to remember this when you read the anatomy of human body. I read something material apart from this ACE material according to human anatomy, and they give you a book as well, but I referred YouTube a lot. So you have to, I recommend you to watch certain YouTube videos which show you what is bulging disc herniation, DDD, mechanical pain, these things. Okay, that will help you a lot in getting understanding about what are these things which cause lower back pain. Because again, out of like I think every other people whom you will be training, I think most of them will be telling you that they like sometime in their life, or maybe most of the time, they suffer from this problem. Okay, now comes the last topic, which is sciatica or sciatica. Nerves coming from the spinal cord get pinched due to narrowing of the outlet holes. Pain radiates along the sciatic nerve, which is down below, which runs down one or both legs from the lower back. Pain, numbness or tingling sensation along the affected nerve. Okay, avoid repetitive bending, twisting. Use back support during overhead activities, and learn how to stabilize the trunk with moderate lordosis or neutral spine position. I'll read it again for you. Sciatica is nerves coming out of the spinal cord get pinched due to narrowing of the outlet holes. Pain radiates from along with sciatic nerve which runs down one or both leg from the lower back. Okay, pain, numbness, tingling sensation along with the affected nerve. Avoid repetitive bending, twisting. Okay, use back support during overhead activities, and learn how to stabilize the trunk with moderate lordosis and neutral spine position. So guys, I highly recommend you to watch YouTube videos and see these conditions on internet, so that at least if you don't have time to watch videos, then definitely see the photographs, images of how does the ankle sprain, acute injury, chronic injury, rotator cuff, carpal tunnel syndrome, elbow tendinitis, lower back pain, sciatica, shin splints, infrapatellar tendinitis, Achilles tendinitis, plantar fasciitis, patellofemoral band syndrome, iliotibial band, greater trochanteric bursitis, tendinitis, fasciitis, plantar fasciitis, bursitis, chondromalacia, medial collateral ligament, and anterior cruciate ligament. These many topics watch on internet. Definitely they are going to help you. And if you want to become a good trainer with great knowledge, then definitely you should know all these concepts. And this comes now. Okay, the chapter has ended, and we'll be doing the next chapter, which is chapter number 16, emergency assessment. Okay, this is also a very, very important chapter. This will be talking about diabetes and so many things: heat stress, hyperglycemia, peripheral neuropathy, Cold stress, shock. Okay, this is going to be a big chapter. Okay. So we'll meet in the next video. I hope this video is going to help you. Kindly watch this and develop some understanding. Refer a lot of internet material along with your textbook. And if you find this video helpful, then please do like me. It will increase my motivation to make more videos and more help towards the community. If in case you need my notes, then just feel free to contact me anytime over email, reallyjustlyfit.owner@gmail.com. I'll put that in description. Along with that, you can reach out to me on YouTube comments. And if you find my channel helpful, please do subscribe to it. Thank you so much for watching, and we'll meet in the next video. Thank you.